The following instructions are for a retracted or indwelling penis. Some users and patients have retracted or indwelling penises, making it difficult to attach condom catheters or even QuickChange wraps on the penis. In this circumstance, you will fold the wrap both underneath and around the scrotum, as well as the penis. To begin, place the wrap on the abdomen with the white absorbent side up. Make sure the round edge is towards the head of the body and the two flaps are towards the legs. Slide the wrap down so that the inner ring is as low towards the base of the shaft as possible, or, if totally retracted, the tip of the penis. Slide the pointed flap between the thigh and scrotum, and then scoop up the entire scrotum, lifting upwards. Make sure the folded flap is close to a 45-degree angle. Next, fold the straight flap over the first fold, slightly pulling upwards, making sure there is a snug, semi-tight fit around the penis and scrotum to prevent possible leakage. With 2 fingers, pinch the hook fastener and inner flap together to ensure attachment. The wrap's overall shape will still be a fan. However, it is normal for this shape to be more open and fuller and not lay flat. The top round edges may not align as the scrotum inside the wrap changes the alignment slightly. Remember, the top rounded side is not sealed so that heat and humidity can escape.